Welcome to IMCAS TV 10 Minutes with Dr. Moll. From France, a plastic surgeon and humanitarian, if I may say so. Dr. Moll is a founding member of the French Society of Plastic and Aesthetic Surgeons and is also the IMCAS Plastic Surgery Course Director this year in Paris. It is the 15th anniversary of IMCAS, and tonight is going to be a celebration of that occasion with La Nuit des IMCAS Awards. The awards will highlight the most challenging, the most humanitarian projects which will be presented and honored this evening. And why this year a humanitarian award?
Well, we are in a world in crisis, and it's impossible to forget that a lot of people are not lucky enough to have the same requirement that the ones we are taking care of daily here. So I think it's very important not to forget them and not to think that we're only superficial doctors.
Yeah, the things that we take for granted don't exist sometimes in many countries. And in which ways can your medical specialty, whether it be plastic surgery or cosmetic dermatology, be associated with humanitarian work? Where can you intervene?
Well, before to be cosmetic doctors, we are doctors first. And we have a lot to deal with skin problems. So if you imagine that a burned child in Africa has not skin problem, we are totally out of our consideration. So here we have the opportunity to match with the most important thing of our specialty, which is the skin. And so I think that reconstructive and dermatologists, doctors, are really at the right place when they're taking care of humanitarian problems.
Right. You spoke about burns, but there's also birth defects.
Right. Yes, yes. A lot of congenital defects and acquired defects. We have to deal also with war, bullet problems, and so on. So it's a huge amount of people we are to taking care of.
And how can a Congress like IMCAS bring awareness and support to your humanitarian actions?
I think we can shine the light much more on the action than on the people. So for me, the awards are more dedicated to an action than to a man. That's why we would like to underline the extreme sensibility of the action before to make evidence for people to be awarded. You know.
Yeah, yeah.
Understand what I mean?
Yeah, and that actually leads to my next question. And without revealing too much, what was your criteria or the selection process for this year's humanitarian award?
First, we wanted to award actions that are on the way and not projects. So all the actions that will be awarded are done for several years.
Right, actions that are already in process.
Right, they are all in process
that
right
have already
now.
taken off.
Yes.
And where in the world do you think you're needed the most?
You know, I think most of the countries in the intertropical area are really far away from the basic needs of health today. So I think there's a huge amount of country where we can have a good action, mostly in Asia, Africa, and Latin America. Our sensibility from Europe is more turned because of historic considerations to Africa and Asia.
And there's a lot of NGOs, there's a lot of associations, there's a lot of charities in the world. As a doctor, is it easier for a doctor or somebody in the medical profession to go into these countries? Is there less government regulation for you? Is there less controversy for a doctor to go in than a NGO, for example?
Yeah, it was like this, I would say, when we started 30 years ago. Remember that the name French doctors was not done for nothing. You know, the because we're really involved in humanitarian action when they started.
Mm.
And at that time, it was very easy. Just saying, I'm a doctor, I'm a surgeon, okay, come and help us. Now we have to deal with a lot of regulation. I accept that, of course, but we have more and more administration, and sometimes we lose time and we lose power in these administration's problems.
Especially when time is of the essence in
Right,
many of these countries.
right.
The other question I had is not only doctors getting to these countries, but what about medicine getting to these countries?
What do you mean by medicine?
I mean, getting treatments to these countries.
Right.
You know, there's not modern hospitals, there's not modern medicine. Many times they don't have access to medicine.
That's right.
Treatments.
That's right. I should say that this is more a consideration for the long-term treatments. In surgery, for instance, we have very short actions,
Right.
and we can solve some problems in a very short time. But when you want to have an action on AIDS, for instance, you have to imagine that you need at least a 2 years action to really end with your program.
Right, right. And before I leave you, I want to hear about your personal humanitarian projects.
Well, I started humanitarian actions with leprosy. This was 25 years ago, and so I went on mostly in Africa.
Mostly in
I had a few actions in Latin America, but very few. And so I share my time with 2 to 3 missions a year, and I share them between Western and Eastern Africa with 2 different humanitarian organizations.
From France.
No, one is from France. It's Médecins du Monde. You see it, right?
I see it.
And the other one is from Switzerland.
So you do work with your colleagues from all over the world on many humanitarian
Yes,
actions.
we try.
And do you train other doctors in other countries, in emerging countries, as that's part of what you do as well?
That should be our main action.
Yeah, because you were talking about you go in, you perform a
Right.
surgery, and you leave. And there has to be a follow-up. And the follow-up
Absolutely.
can only be done locally.
So for any action, we have to have somebody confident in the place, you know. So we have to find a doctor who would be interested in our specialty, which is not very
Yeah,
easy
yeah, yeah.
overall in Western Africa. In Eastern Africa, we found a lot of doctors that are developing now their own skills, and we meet them every year. We change the place in different countries, and we gather them, and we have a 1 week program to share our experience, to discuss cases. They send them by internet, of course, today. So that's a good way,
That's a
I
wonderful
think,
way.
to really promote our techniques.
Well, thank you very much, and wonderful what you're doing, and we will see you tonight.
I thank you very
Thank
much.
you.
Bye-bye.